The primary recommendations are around enhanced use of the prescription drug monitoring program, so we can anticipate regulations that would require pharmacists to use the prescription monitoring program whenever they dispense an opiate prescription. Pharmacists may be required to provide specific types of education to patients when they dispense prescriptions for opiates. Already at this point, pharmacists are being educated to dispense naloxone kits. Naloxone is the drug that is being used as in emergency recovery for opiate overdoses. So that's already in place, although it's not widely accepted by pharmacies yet. So it's likely that there'll be an increased emphasis on pharmacies dispensing these naloxone kits for at-risk individuals and their families. So there are recommendations from the task force about optimal prescribing and dispensing guidelines. Whether or not those translate to a regulation is dependent on how the governor and the legislature respond to the task force report. So they may not end up as regulations, but rather as professional practice guidelines. The pharmacy provider community, not just now, but for some years, has been clamoring for better practice guidelines, best practices on how to handle these uncomfortable situations where they recognize a pattern of misuse or abuse, but feel somewhat powerless to do something about it. And that's something that is likely to change as a result of the Opiate Task Force. The regulations, for example, are likely to impose requirements on the part of insurers and payers, as well as regulations to decrease the volume of opiates that are in the marketplace. Now they will have some teeth in the form of regulations and other management controls that will allow them to manage those prescriptions and to report that to appropriate authorities, to registries, maybe to the Board of Registration of Medicine, for example, if they see a prescribing pattern from a physician that is suspect, that type of thing. Some of the things that pharmacists see are physicians that prescribe only opiates. That's a suspect behavior. They see patients getting prescriptions filled for very high quantities of opiates repeatedly. That's also a suspicious behavior. They see patients traveling great distances. So the physician and the patient live in one town and they come 60 miles to get their prescriptions filled. That's another suspect practice. Or they see a pattern of utilization of multiple drugs that are commonplace in a patient or a person who is likely to be misusing or abusing drugs. Pharmacists get frustrated by this, of course, and sometimes they will collectively or collaborate with other pharmacies to put the word out. But there's no formal mechanism for doing that unless, for example, a corporate pharmacy like CVS or Walgreens takes the initiative to inform their pharmacies to be cautious about a particular prescriber or a patient.